Parliamentary updates.
The Joint Select Committee on Social Services and Public Administration is holding a series of town hall meetings as part of its inquiry into Trinidad and Tobago's response to the prevalence of non-communicable diseases with specific focus on diabetes, cardiological diseases and cancer. Chairman of the committee, Senator Dr. Paul Richards, explained the reasons for holding town hall meetings in particular.
We've planned these town hall meetings to have a closer interface with the people of Trinidad and Tobago on issues that affect them in their daily lives. The rationale for the inquiry and our town hall meetings is as follows. Over the past 3 years, the committee has focused on examining the workings of the education system. During the session of Parliament 2023 to 2024, the committee has turned its attention to an equally important matter, public health care services. Healthcare is a very broad and multifaceted area, so the committee has narrowed it down in terms of its focus to the following 3 areas. 1, combating non-communicable diseases, diabetes, cardiological diseases, and cancer. 2, focusing on the effectiveness of the Chronic Disease Assistance Program. And 3, the standard of service at outpatient clinics.
At the first meeting held at the Parliamentary complex in Port of Spain, mental health and sports medicine professional Dr. Maya Blackman addressed the audience.
We are presently not wellness promoting. We are instead very much illness managing and barely managing at that. But like I said, we can change it. And again, the changes we see start with trust, and confidence and competence that builds that. Confidence in ourselves, competence in knowing what is healthy and what's not. And to be fair, that's kind of easy. Every single person here knows that we need to move more, eat less. But we will wait in a fast food line for half an hour instead of cooking something. Same cost, same time, more effort. Because we don't think we're worth it, I guess. I think we are. I wish you thought so too.
Dr. Blackman encouraged citizens to educate themselves so they can live better lives.
The behavioral science behind why we pick something full of calories, fat, and salt when we know that it inches us closer to death, much more complicated. But like anything else, it gets easier if we practice it. If we all work on prevention strategies and encourage those around us to make healthier choices like we know we should. Coming in, I was encouraging one of nice police officers to not drink a Cokes, right? Things like more water, less seed drink. And juices often having just as much sugar, so let's try to avoid that as much as possible. More fruits and vegetables because they're lower in calories, lots of antioxidants, and generally encourage weight loss. But also understand when you're eating a bunch of fruits that if something tastes sweet, it's because there's a lot of sugar in it. And a bucket full of mangoes is not a serving. I'm not saying that sugar is evil, but what we need to do is provide the calories our body needs, not more than that.
Members of the public were then invited to give their experiences regarding the management of the healthcare system.
I don't consider myself elderly in no way, but I felt it for the elderly people. Now I use the public healthcare because I love the testing. You can get testing for free, and I applaud that because we don't appreciate the healthcare system that we have in Trinidad and Tobago, where we can have access to certain, like x-rays, blood sugars, you name it, testing, etc. So when I got there, obviously, now something needs to be done with the nurses as well, because honestly speaking, they're rude to the patients, right? And these are elderly people, and they're asking questions because there are no young ones with them. So they're asking questions about, where do I go, but to be yelled at or spoken down in a derogatory manner, which is not nice. And there was a particular nurse that was not well that day, I'm assuming, And she was very, very aggressive towards the elderly. And I mean, when I went to the doctor, I couldn't even go to the doctor with my issue because I had to fight to actually see the doctor, because if I didn't take a picture of my card, it would have gotten misplaced. They couldn't find my file. So you could imagine their situation, and something needs to be done about that.
Talking about the experience that my father encountered, he lives in Tobago and he has a heart condition. So to really get a doctor that really is permanent there is impossible. I hear that the doctor has to come from Trinidad up to Tobago. And he hasn't seen the doctor over the COVID period. That COVID, he was diagnosed. He used to go to the clinic before to see the doctor up in Scarborough. And of course, visiting the doctor was far. Getting appointments was far. So anytime he get one, he got it. But for the COVID period, he didn't get any. And since then, after the COVID, it's difficult to really get an appointment for my father to see a doctor for that particular ailment that he has, which is dealing with his heart. Right now, thank the Lord, he has to go private, which is a costly figure to see a doctor to deal with your heart. But he really, really and truly, he should be able to get access.
The Parliament channel spoke with some of the attendees.
I think it's a great initiative. It really opened up a space where, a lot of people, members of the public, civilians, could have gotten that opportunity to share their views on things that really affected them. I noticed that there were a lot of elderly persons, nurses. So I think there was a really nice connection there where they could have rebutted each other and whatnot. So it was really great. I really hope it achieves what everyone really talked about in terms of, well, one, the education, and there are a lot of people that were against that, but education is really the foundation of all action, I'd say. So implementing that not only on a governmental level is what I'd hope they would achieve on a society level as well. We need to band together in unity to get these things done for the working betterment of decreasing NCDs in Trinidad and Tobago.
Indeed, it's democracy in action. It's ability for members of the public, members of stakeholder NGOs to be able to speak one-on-one with independent senators, opposition senators, government senators, to really express how we view and how services impact directly upon us, and what suggestions, recommendations we can make to really improve the system. So really it's a marvelous initiative by the committee. Well, I really hope the recommendations that emanate from this important exercise really reaches the policymakers, the government officials, to really make tangible changes within the healthcare arena, within the healthcare space. For far too long, our citizens have been negatively affected by certain shortfalls within our healthcare landscape. And with some of these recommendations, with some of these, the spotlight being placed on these negatives directly from the citizens, manifesting itself in some of the recommendations. We hope some of these changes could be made once and for all. Yeah?
I think it's a very good initiative, because I think it will really, at least they will get some sense of what the public thinks about aspects of the public healthcare system. So whether it may be looking from the clinician side and looking from the patient side, to see what the challenges are, both on the patient side, both on the clinician side, and maybe see what the gaps are and how they could be rectified, whether it be through maybe some changes within the system, or whether it be like policy or legislation. In terms of like changes, especially with regards to this topic, with regards to the public healthcare system, and I know they made like much more of an emphasis with regards to NCDs, treatment of high blood pressure, diabetes, cancer, and so forth. I hope that in terms of like those diseases, the people who are dealing with those diseases, that they are treated in an efficient manner, time-effective manner, whatever gaps with regards to treatment, that they are dealt with, and the gaps are closed. And then also, we can also look at what the bigger picture is in terms of like getting people not to come into the system. So therefore, you want to see like less people come into the system with these diseases.
I think it's an excellent initiative. It gives the public an opportunity to let their voices be heard in the management of the healthcare system of Trinidad and Tobago. I hope that the committee will be able to take the questions, the comments, and the various initiatives that the public presented and carry it forward so that we could actually achieve a better healthcare in Trinidad and Tobago.
The next stop was in San Fernando at the City Hall Auditorium. At this town hall meeting, Acting Manager of Health and Disease Prevention at the Southwest Regional Health Authority, Dr. Sandy Arthur, addressed those present about the different types of risk factors for NCDs.
So non-modifiable risk factors, for example, we cannot change how old we are. We cannot change, although I think sometimes some of us may like to, we can't change our genetics, so we can't change our family history. However, there are some other things that we can change and we can modify, namely our lifestyle. So if we have an inactive lifestyle, we know that that is one that increases our risk for chronic illnesses. Our dietary choices is another big one. I think we've transitioned from the era of having persons who were undernourished, which in itself has its problems as well. And now we have a lot of overnutrition going on. I think that's a nice way to put it without calling other names. And therefore, with that has come a lot of the other challenges and problems that we are seeing. For example, increased risk then of heart disease, hypertension, and diabetes. Or use of certain substances, so for example, alcohol use and the use of cigarettes. These things are things that we can modify. Something that's up and coming in our society today is the use of these vaping devices. Persons would have seen it as an alternative to use of cigarettes and so on, but these come with its own inherent challenges and risk and lung disease. There's actually this emergent syndrome, EVALI, which is associated to the use of e-cigarettes and vaping devices causing lung injury. Weight is another challenge that we can work on, another modifiable risk factor.
Dr. Arthur gave an overview of how serious the problem of NCDs is in this country.
Trinidad is no exception to the Caribbean, and unfortunately, they account for about 60% of our deaths annually. If we look at the top 4 conditions that cause death, or chronic diseases that cause death according to the National Strategic Plan for the Prevention of NCDs for Trinidad and Tobago, heart disease is number 1, 25%, followed by diabetes, which is 14%, cancers at 13%, and cerebral vascular disease, that's a big word for just brain vascular issues, 10%. So you can see that basically about 2/3 of our people die every year from some form of a chronic disease.
Here too, members of the public relayed their experiences.
On that day, it was the first day of a change of outpatient management and policy and procedure. I think they're now introducing something called a block system where you're actually given an appointment time. Sadly, it's good the change is there. It is good that the system is being reviewed. It is good that new methods are being tried. I think what was totally absent was the communication with the patient, the recipient. Come 12 midday, my sister is still waiting to be seen, but we know that it's a clinic that runs late, and I'm waiting for a new appointment, and suddenly everything stopped. All the clerical staff are now going for lunch from 12 midday to 1 p.m. Now, if the service has changed in terms of extended hours, of course the staff have to eat, and that's perfectly acceptable. However, no one told the patients. And therefore, you had a long line of patients, elderly, infirm, special needs. The window was closed at 12, and they stood there for 1 hour until the staff returned. Had numbers been issued, because there were many vacant seats by lunchtime that could have been occupied, but people didn't want to leave the line in case they lost their place. And had numbers been issued to say, please take a seat, and when we come back, we will call you. According to these numbers, 90% of those problems would have been erased.
I'm a mental health consultant, and so I want to make a strong claim for the introduction of mental health training among the staff, hospital staff. But in terms of my own experience some years ago, I visited the San Fernando General Hospital with my ailing daughter, and we had to wait approximately 18 hours before we can receive treatment. And at no point any hospital staff came to say, well, look, we're sorry for the delay, but doctor will see you soon. No one came to reassure or to update us. Having worked extensively, both at St. Anne's Hospital and in the health system in England for many years, it then occurred to me that a lot of the patients visiting the general hospital, in fact the A&E, have mental health issues. And because of the culture of fear of mentally ill persons, the hospital staff sort of avoid dealing with these persons for fear of maybe they would be attacked or so on. But I believe that if they are trained to a certain extent, they will be more understanding and empathic and able to deal with the issue. In Trinidad here, what they do if such a situation occurs, they would call the security or the police, who are not trained in any way. And I see that as a punitive step.
We also spoke with members of the audience.
Well, I think from the interaction with the general public, what we are looking for as the public is the improvement of our health sector and our health service. We understand that the government is giving a lot of allocations and resources towards the health system, but there are a lot of discrepancies and things that are missing in terms of ensuring better health care and better services provided to the general public. So I think coming out of these public consultations, what we hope to see is the improvement of services, and it's small things, the digitization of files and ensuring that customers and clients feel comfortable. So it's about improving communications, streamlines, and services. So it's something that all of the complaints and suggestions can now be materialized to an improved health system within Trinidad and Tobago. For me, I think the only suggestion I may have is to improve on the channels of communication. I know the Parliament does an excellent job on social media as well as radio, but I think in terms of sometimes meeting the people on the ground and doing simple ads in the communities, as well as going around with a vehicle and sharing the information, that can lend assistance so that people can come out to share their information, because there are a lot of persons who would be interested in sharing their thoughts on the different aspects in terms of public health and other issues that affect us on a daily basis.
This has been a wonderful forum for me to be able to praise my community for all the wonderful job that they have been doing with our healthcare up in the Burroughs area. I know it have problems in and around, but I want to say that our area is kind of blessed. With that being said, I hope that the little problems, the suggestions we make, that it really reach to some air and the improvements take place, one step at a time.
Well, I hope they achieve, like everybody, to get everybody on point with health, because right now people are asking, and especially, we're speaking about like the wellness. People need to start from home. So you give your children, from then you stop giving them the sweet drink and the sweet stuff. Give them fruits and vegetables so they'll grow up better, make them play more. And when it comes to us adults, we must adhere to what we need to do. Go out and walk, have some fun, because that is what TAP is all about also.
From these meetings, I hope that this committee achieves getting the stories of the people and the actual problems that they're facing on a daily basis, trying to access healthcare in the public sphere. And I'm hoping that this can go to the highest levels where we can actually see some actual concrete changes and better policies to serve the citizens of Trinidad and Tobago. I think it's absolutely excellent getting the citizens to actually get involved in their everyday lives, their issues that are facing them, and get in touch with the committees, get their voices heard directly instead of just written submissions.
Stay tuned for further parliamentary updates. For more information, visit our website at ttparliament.org and follow us on Facebook, YouTube, Twitter, and Instagram.
Parliamentary updates.